The BCMA loss is something we have started to observe with the KARMA study after BCMA-treated anti-BCMA targeting CAR T-cell therapy in myeloma. And our group, in addition to Leo Russia's group and Paula Neri's group, has actually presented at last ASH with different escape mechanisms. In our case study, we had one patient who was heavily treated before the CAR T-cell induction, and then patient got the first infusion. There was a partial response. However, 9 months after the first induction, patient relapsed. When patient relapsed, this patient got a second treatment with same BCMA targeting treatment with higher dose, but there was no response. So we were puzzled, and we were trying to understand it. We have done a bunch of single cell RNA sequencing to look at the microenvironment cells and the tumor intrinsic factors. And what we found was that this patient had a very tiny subclone before the first induction. And because BCMA targeting therapies are strong therapies that cause a selection and clonal evolution, we believe that this patient got a clonal evolution with the treatment. And the clonal evolution actually selected a clone that has a BCMA deletion, and that the second allele had a BCMA mutation that creates the early stop codon, which eventually caused a BCMA loss. And that target loss is actually made the CAR T cells ineffective for this particular patient. In KARMA study that was published in New England Journal of Medicine by Dr. Nikhil Munshi and his colleagues actually showed in the phase 2 study, it's around 4%. I mean, the soluble BCMA loss is around 4%. So what we see and what others have shown might be representing a small portion of the resistance mechanism. However, as we go further, as we understand this better in larger settings, there might be different mechanisms, or the frequency may be actually a little bit higher than what is originally reported in this study. We think that this needs to be carefully followed through the treatments like anti-BCMA targeting CAR T-cell therapies. And in any point, if physicians think that there may be a resistant clone coming, the subsequent therapies and combination therapies should be considered to get more effective response.